As of Sunday, June 14th, Chile has experienced 3,101 deaths due to the coronavirus outbreak. The country reported its first case on March 3rd, and from then until the start of June has confirmed 167,355 cases. However, the government has acknowledged and published an influx of over 31,000 additional cases since only the beginning of June. On June 13th, Chile's health minister, Jaime Mañalich, resigned due to criticism that he has handled the situation poorly and is partially responsible for June's rapid increase in coronavirus cases. This resignation came shortly after an additional 234 deaths were reported in 24 hours, which has been Chile's highest death toll yet. These numbers are especially striking considering Chile is one of the countries with the highest number of daily confirmed cases relative to their population size. Mañalich has been replaced by Dr. Enrique Paris, who formerly headed Chile's medical union. In an attempt to differentiate himself from Mañalich's failing legacy, Paris announced, "I want to call for dialogue and cooperation between research centers, the medical union, and the scientific community. Here begins a new era in which we must hear contrasting opinions." Though Mañalich has handled the coronavirus outbreak well regarding general information access and reporting methods, the country's citizens feel as though he did a poor job effectively controlling the infection rate, as the number of reported coronavirus cases has only increased exponentially since March. One of Mañalich's initial attempts to curb the outbreak was the introduction of an immunity passport, which would allow recovered coronavirus patients to return to work or travel instead of continuing to follow lockdown guidelines. These patients are required to carry documentation stating that they have been infected and recovered. This is where the majority of Mañalich's criticism stems from. The public believes he was too hasty in trying to get the public back to work, priding economic progress over the health and safety of the country's most vulnerable citizens. Former Health Minister Dr. Alvaro Arazo provided further critique of Mañalich's plans by stating that our ability to handle the crisis has been negated by a lackluster strategy that saw the government encourage people to go back to normal. After resigning, Mañalich admitted that he did not acknowledge areas of the country suffering from overcrowding and high rates of poverty, which his immunity passport scheme affected the most. Furthermore, politicians in opposition to Mañalich are considering filing a constitutional complaint against him that alleges his complicity in the poor management of the pandemic. Though the government under Mañalich remained open and honest with the public about the climbing number of cases, they clearly failed to consider the negative effects of a hasty reopening, which led to the skyrocketing number of cases that were confirmed and published in June.